3 infants in Midland have contracted botulism in the past year, and questions are now surrounding how this rare disease hit the Midland area. CBS 7's Lauren Mudd has been looking into this case throughout the month. She joins us now with their stories. Lauren?
That's right, Jay. These cases have been circulating social media since March, with lots of questions remaining unanswered for the parents and the community.
It's happening. It's here. I don't know where it is, but it's here, and our babies are proof.
Botulism. It's a sickness most commonly associated with honey.
Is that the honey thing?
Honey harbors botulism.
Was it honey?
The steps parents can take is to not feed their children honey.
But for 3 Midland babies who've never been in contact with honey, how did this happen?
The first conversation we had was about all of the obvious things that you know about. Was it honey? Was it canned goods? Was there any home construction going on that might have kicked up these infected dirt spores? Went through what felt like a game of 20 questions of all of the things that I could have done to cause it, and the answer was no to all of them.
We're not a farming community. There aren't new builds where we live. Like, you cross off the big ones. Like, none of us have remodeled. Our neighbor didn't just plow down a house and build a new house. Our neighborhoods are pretty established.
Most of the time, botulism is not deadly, especially for adults and even young children, because our immune systems can handle it. However, for infants, the illness can be much more serious.
It's not very common, but it is a medical emergency if it should arise. They would have a hard time breathing. Their face may not have a lot of expression, maybe a droopy eye. They're not able, when they cry, you don't see a lot of expression in their face. They're just not able to move their arms and legs like they usually do.
These are symptoms these parents witnessed firsthand.
We were watching him deteriorate at this point pretty quickly. It's like we were, like not eating, fussy, but now like our muscle tone is going fast.
Yeah, I remember even just handing him off to the nurse's assistant there for the MRI, and I mean he was, yeah, like somewhat lifeless, to be honest, and yeah, that was that moment. We have another son, and I had to go take him to be with parents, and yeah, I remember leaving the hospital at that point after handing him off for the MRI and thinking, I may not see him again. It was at least as the little boy we knew.
Over the last 5 years, the state of Texas has only averaged about 10 infant botulism cases per year.
We may have been 1 in a million, but so were
we.
Mind-blowing to think that we weren't just the only case that we would ever hear.
The city of Midland says at this point in the year, they're unable to determine if this is an uptick in cases.
Are we seeing most of the cases, or about half of the cases now, and we will have fewer later? Unfortunately, until more time passes and we see how many more cases there are, we don't know for sure.
Another reason these cases are raising concern across the community is the close proximity of the infected babies, with all 3 families living within half a mile of each other. Despite this, the city of Midland says they don't believe that the babies contracted the disease in the same way.
There was not a common source of exposure. And so other things have been stated publicly, but based off of our investigation, there was not a common source of exposure.
This begs the question, is this city going to test for the bacteria?
The bacteria is widespread in the environment. We could theoretically test different environmental sources, but there is no guarantee. It might be detected, but it doesn't guarantee that that was the source of exposure or that those toxin types match the toxin types of our cases.
Now, these families just want to raise awareness so that if there are more cases, other parents can react quickly.
You have to go to Lubbock or Fort Worth to get care, proper care. We don't have an ICU for kids, for pediatric ICU.
Like, the urgent care may not be able to take care of a pediatric patient because they're so young, a 2-month-old, a 1-month-old, but for them to hear those symptoms and connect the dots to be able to send immediately to the ER with the right terminology, like, hey, this is suspicion of botulism.
These babies were all treated for botulism with an anti-vax called Baby Big, which stops the bacteria from spreading, but it doesn't heal the areas of the body that were already affected.
The toxins continue to paralyze the body until the antitoxin has been administered. And so it is, I mean, from the perspective of recovery, it is really important to get the antitoxin administered as soon as possible, because the longer you wait, the longer it's going to take for the body to naturally repair the damage that's been done.
I would hate to think what would have happened if we'd waited any longer to get to the doctor or get to the hospital.
Thanks to early detection and quick action, all 3 Midland babies are recovering.
We worked with speech therapists, physical therapist, occupational therapist for, I think, 4 months after his discharge from the hospital before we finally had him caught back up with the milestones of what a baby should be doing. And now he's perfect. He's happy and healthy and doing everything an 8-month-old should be doing.
Now, we've heard from both the parents and the city that there are updates on this case happening periodically. So if anything does change, we will of course continue to keep you updated as we learn more. For now, reporting for CBS 7 First Alert News, I'm Lauren Munt.